Living in a time of recession certainly doesn't give people much to smile about, but one industry seeing growth during these tough times is dentistry. For more on this, we're joined by Dr. Robert Emami, a dentist with Dental Specialties in Massachusetts. Hi, doctor. Thanks for joining us.
Well, thanks for having me.
What do you think is keeping dentistry so strong when the economy in general is struggling?
Well, unfortunately, what's happening is that people are worried about losing their jobs, losing their homes, 401ks, retirements, and it's causing an incredible amount of stress on them. And while they sleep, the stress is manifested into grinding and bruxing and clenching their teeth together, which causes multiple fractures and more bills for them. And, you know, this stress is really causing an issue.
So you're actually seeing an increase in teeth grinding because of the stress?
Oh, absolutely. Most of the time, this grinding that patients are encountering at night or the clenching that they're encountering at night is stress-related. So, more stress, and they have more issues with grinding and clenching.
So interesting. Do you think that also it's possible that people are fearful they might get laid off and lose their insurance, so they're rushing to the dentist while they're still covered?
You know, that's definitely true, and the people that are doing that are incredibly smart patients. In other words, they're using up their dental insurance while they have it to free themselves of any dental diseases they might have, rather than waiting for their insurances to expire, and it becomes a cost burden on them completely.
And then what about the people that have been recently laid off? Are they still making appointments, or is visiting the dentist the one thing that gets put on hold until you really can't put it off anymore?
You know, if they don't put it off, they're better off. In other words, preventative care is always easier, less painful, less expensive to repair. So if they come in even though they don't have dental insurance, we can maintain them and keep them healthier so that they don't have catastrophes down the road, which is very important.
So are you seeing an increase in different kinds of procedures? Are people mostly coming in for cleanings, or are you seeing more complicated work like root canals?
Well, actually, very good. What's happening is the patient, well, everybody's stressed nowadays, but the ones who are really suffering between the clenching and the grinding they're doing at night are really causing some major damage to their teeth. And what happens is this grinding and the clenching causes fractures of teeth, which is very, very costly to repair. So it's important for them to do things so they don't clench and they don't grind at night. And a mouth guard is what is needed for that, and we've seen probably 2- or 3-fold in patients that require or need an appliance like this.
Interesting. And what about cosmetic dentistry? Has that been doing quite well during the recession?
Actually, cosmetic dentistry has definitely tapered down. But again, it's important for patients to maintain during this. If they lose their dental insurance, it's important for them to continue going to their dentist. Preventative care. Make sure they stay disease-free, make sure their mouths stay healthy, and if their mouths stay healthy, then they don't require much work. Or what they can be doing is putting work off. And remember, there's lots of things we can do to buy patients time, and it's important for them to be coming in so they can get the required care they need, so we can buy them time until hopefully the economy turns around or they re-get their dental insurance or their dental benefits.
And doctor, on a personal level, how much have you seen your practice increase during this downturn in the economy?
You know, the practice has definitely increased, and again, not cosmetically, but with respect to function. And patients are stressed. I have a lot of patients that come in because they have facial pain, and they don't realize. They say to me, I wake up, doctor, and I have headaches every morning. And what is happening is I discuss with them their routines of their day, and I realize the amount of stress they're encountering. Again, we've all lost money on 401ks, and we're all worried about losing jobs and the recession and the economy and the stimulus package and so forth. And what has happened is these patients are sleeping at night, and they're letting their aggressions on their teeth by grinding and clenching as hard as possible. Remember, the facial muscles are incredibly powerful, and these 2 teeth come together and they rub and they grind and they cause fractures and facial pain. And now these patients aren't sleeping well, they're uncomfortable, and it just escalates from there. The easiest way is to have a mouth appliance made. They wear it at night, they get to sleep more comfortably, and when they sleep more comfortably, they tend to do better during the day and be able to concentrate on what they need to do to pull themselves or pull us all out of this economic crisis, if you will.
So I guess for some students who are still trying to figure out what career path to pursue, they should keep in mind that dentistry is still looking good. Dr. Robert Emami, thank you so much for joining us today.
Well, thank you for having me.